My name is Schoffstall. I'm a Vice President with CGI Federal in their health group. So working with HHS and SSA, really go through digital transformation and innovate. The federal government has been looking to improve and trying to improve their services to citizens for years. The 21st Century Cures Act came out a few years ago. It identified 25 high-impact service providers, of which CMS for Medicare and then SSA for retirement and disability are among those agencies. And it's really focused on improving the customer experience. And then President Biden issued an executive order this past December that just said we want to put the customer at the center of all the different transactions. So regardless if your transaction goes across multiple agencies, really you should have one portal, be able to do your transaction kind of in a user-centric way, and not have to go to a bunch of different agencies. And so that's what we're focusing on, helping, mainly I'm helping HHS do that with Medicare. So Medicare.gov is a site that we have helped them be engineering for multiple years. We've won several awards with that. And the MyMedicare.gov is for Medicare enrollments. And so you can enroll in your Medicare, which type you want, whether it's, you always get Part A, but then you can get Part B or C, which is the supplemental or the Medicare Advantage, and then Part D is the prescription drug. And so all that's through the My Medicare portal that we've helped engineer along with HHS. RPA has made a really good impact on the federal market. So we're working with SSA and we've helped them implement RPA a few years ago. So SSA has a lot of legacy systems, a lot of processes that revolve around enumeration when you get your Social Security number, earnings, so every paycheck, your payroll taxes go there, and then retirement, getting Medicare, and then if for some reason you or a family member becomes disabled, also disability and supplemental income. So all those different processes have backing systems, multiple backing systems, about 1,400 of them actually. And so the processes can be very complex for the customer service representative to get the enrollment done or the beneficiaries ready for the citizen. So by leveraging RPA, we're taking a lot of those manual processes that are behind the scenes and having an attended bot do those processes so that the CSR can focus on the customer and provide a higher level of customer service. So for the digital customer experience, it really is focused on putting the citizen in the center of the transactions. So if you think about all the different transactions that we do at the federal level, so whether it's related to agriculture or food and drug, travel, especially with COVID and traveling, there's a lot of activity that's going on with federal sites. And the goal is to improve those processes so that the citizen doesn't have to spend a lot of time. Really, it should be get in, do your thing, and get out. Kind of think about like online banking, right? If you want to if you want a rocket mortgage, right, it can be very quick, something like that. They want that same type of paradigm to be in the federal marketplace. So of course there's a little bit more complicated. You have to have a lot of identity proofing that goes on and verification, but really those things should still be behind the scenes so that the user has a very streamlined experience. The recent executive order was talking about putting the citizen in the center of the transaction and making it streamlined. So if we think about the population that interacts with government, it's usually people who are older. And so you have to be cognizant of if there's any disabilities. So there's Section 508, which is legislation that talks about the website or the mobile device being able to be used by someone who is blind or colorblind or deaf. So you have to have that built in. That's part of the customer experience. And then you have to apply the same commercially available omni-channel capabilities. So let's say that somebody makes a call and they start the process, but they have to drop off and they want to finish it on the web later. Well, that omni-channel means they could pick up right where they left off. And so that capability needs to be built into all the different government systems. Building a streamlined or a very high level of quality customer experience site is not easy. Right? There's a lot of pieces, parts that go into it. You have all the technology stack, and then you have the human-centered design process, where we have design experts that work with the government agencies and also user groups to identify, okay, what would be the best way to get this done? Well, and we think of it in terms of a user journey. So if English isn't your first language, you need to have sites that support multiple languages. So that needs to be built in. And then if someone does have a disability, you need to have capabilities for that. And then also things need to be explained well, usually more white space, not a lot of compact text, easier. If there's videos to kind of explain how to do it that can be built into the site, that's a good way to go. So it really, and all that needs to come together in really a change management kind of paradigm, because the government is changing the way that they're delivering the services. Right, back when they were put in, when the internet came into being, it's pretty much everything was paper, right? So they just took that same paper process and put it on the internet. And so then we've been trying to improve that over the years to really make it digital. There needs to be that forethought and kind of bringing all those different capabilities together in a streamlined digital experience. So you need to be able to do things like have feedback loops built in, how we can improve. There needs to be the capability to call back, or like I said, to pick up where you left off. And there's a lot of technical capabilities that go on behind the scenes with that, from the web layer to the middle application layer to the database, all the security that goes into it. So there's quite a bit to that. Next 5 years of healthcare technology, that is very promising, very exciting. Precision medicine is something that has such a potential to change our health in later years. Also changing our health even in younger years for things that are discovered in an early age or adolescence. So it's a very exciting time. So there's a lot of advancements on the healthcare delivery side, but then the back office and the government regulations need to be able to support that. For healthcare, there is a higher level of standards as far as is it safe. It needs to be safe and reliable, and so there's a lot of processes and regulations that go into that. But it also needs to be done in a streamlined fashion. If you have some new technology that really is going to help people either avoid illness or cure an illness, you can't have it sitting in process for 10 years, right? You have to be able to move that along quicker. And so there's technological advances in actually making that process go quicker. So with artificial intelligence and machine learning, the systems can identify maybe adverse affections quicker, so that if you are working on a drug or a therapy, finding that adverse reaction quicker means that now you don't continue with that. You put that down and pick up something else or change it a little bit. And so when you get to your end product, there's very little uncertainty about is it safe and effective. So I think that's really going, so I think more precision medicine, there's going to be more care possibilities delivered in a more rapid fashion. So it's a very exciting time.